You know that feeling, right? When you've been sitting still for a while, maybe working, maybe traveling, and you just get this overwhelming urge, like you have to move your legs, stretch them out.
Yeah, that fidgety feeling. Most people know that occasionally.
Exactly. But what if it wasn't just occasional? What if it was, well, almost constant when you're resting?
And ME came with some really odd sensations, too.
Yes, like tingling or burning or even that weird feeling like something's crawling under your skin. And imagine that hitting you every single night just as you're trying to sleep, turning bedtime into, well, a nightmare.
That experience. That's pretty much the starting point for what we're diving into today. The material you shared looks at something much bigger than just fidgeting.
Right.
We're talking about restless leg syndrome. You might also see it called Willis-Ekbom disease.
Willis-Ekbom disease. Okay, that's the more formal name. So our mission today is really to understand what RLS actually is.
What causes it, potentially?
How doctors figure it out and what can be done about it. The sources paint this picture of, of those uncomfortable leg feelings tied to that just got to move urge.
And crucially, like you said, moving only helps for a bit.
Right. You get up, walk around, feel better.
And then you sit or lie down again.
And bam, it starts creeping back. Sounds incredibly frustrating.
It really is. And that leads us straight into the massive impact it has on sleep. That's often the biggest challenge for people with RLS.
Falling asleep, staying asleep. It must be awful.
It creates this really vicious cycle of being disturbed all night.
Yeah.
And get this, the material highlights that over 80% of people with RLS also have something called periodic limb movements in sleep, PLMS.
Wow, 80%? What's PLMS exactly?
It's basically involuntary jerking or spasms, mostly in the legs, but sometimes arms too, happening repeatedly during sleep.
So even if they manage to drift off, they're still being disturbed.
Precisely. It fragments their sleep even further.
That really drives home why it's classified as a sleep disorder then. It's not just annoying leg feelings.
Absolutely. It leads directly to that daytime exhaustion, the brain fog, trouble concentrating at work or school.
And the sources even mentioned possible links to anxiety and depression down the line.
Yes. The chronic nature of it, the lack of sleep, it can definitely take a toll on mental health. It can be really debilitating, especially in severe cases.
And it tends to get worse with age, apparently.
That's often the case, yes. The symptoms can become more frequent, more intense over time. It really impacts quality of life.
It sounds quite common, too. The numbers mentioned were like 5 to 15% of people globally.
That's what the estimates suggest, yes. It's surprisingly prevalent.
But despite that, it's often underdiagnosed. Takes years sometimes.
That's another striking point from the material.
Yeah.
Years can go by before someone gets an accurate diagnosis. People might think it's just stress or poor circulation or, just part of getting older.
Wow. Years of struggling without knowing why. Okay, so we've got a handle on what it is and how disruptive it can be. Let's dig into who gets it and what might be going on underneath.
Sure. Well, the information suggests a couple of trends. First, it seems to be more common in women, roughly twice as common as in men.
Interesting. Any age group?
It can start at any age, really, but it's more frequently reported or perhaps diagnosed in middle-aged and older adults.
Okay.
Oh, and pregnancy is another key time. It's significantly more common during pregnancy.
Ah, okay. But does it stick around after?
Thankfully, for most women who develop it during pregnancy, the symptoms usually clear up after they give birth.
That's a relief to know. So the big question then, what's actually causing it? The sources mention two main types, primary and secondary.
That's right. It's helpful to think of it in those two categories. Secondary RLS is maybe easier to grasp first.
Okay.
That's when the RLS seems to be linked to some other underlying medical condition.
Like what?
The material specifically calls out things like iron deficiency anemia, diabetes, also celiac disease, kidney problems. Basically, another health issue is thought to be the trigger.
Right. And the iron deficiency link sounds particularly important.
It really does. There seems to be a strong connection there.
Okay, let's unpack that iron connection a bit. The sources explained iron's role in making dopamine, right?
Exactly. Iron is vital for producing dopamine, which is a key neurotransmitter. Think of it as a chemical messenger in the brain.
And dopamine does loads of things, mood, learning, but also movement.
Yes, movement controls are the big one. Proper dopamine signaling is essential for smooth, coordinated movements.
Okay.
Now, the material draws a really interesting parallel with Parkinson's disease.
Ah, I saw that.
In Parkinson's, those dopamine-producing brain cells start to die off, leading to low dopamine levels and the classic motor symptoms, tremors, stiffness.
Right.
With RLS, especially when linked to low iron, it looks like there might be a similar, though distinct, disruption in that dopamine system.
So low iron means the body maybe can't make enough dopamine, or perhaps use it properly.
That seems to be the idea. If iron levels are low, dopamine production or signaling might be inefficient, potentially contributing to those RLS symptoms like the urge to move and maybe even those leg jerks.
It's not necessarily cell death like in Parkinson's, but more about the function.
Possibly. It might be about how effectively dopamine signals are getting through in specific brain areas that control movement, areas like the substantia nigra, perhaps, which is involved in both conditions.
That makes a lot of sense. Low iron, less effective dopamine signaling, restless legs. And it fits with some Parkinson's patients also having RLS.
It does seem to support that dopamine pathway involvement, yes.
So that covers secondary RLS, where we can point to another cause, like low iron. But what about when there isn't an obvious cause?
Right, and that's actually the majority of cases. That's what we call primary or idiopathic RLS. Idiopathic just means the cause is unknown.
So most people with RLS, we don't know the exact trigger.
We don't know the specific underlying cause, no. But the information strongly suggests genetics play a big part.
Ah, the family connection.
Yes, primary RLS definitely seems to run in families. If you have it, there's a decent chance a close relative does too.
And the sources said something about age of onset in those cases.
That's right. When there's a family history, people often tend to develop symptoms earlier, maybe before age 45, and the condition might progress a bit more slowly.
Okay. So given there isn't like a blood test for RLS itself, how does a doctor diagnose it?
It's really based on a clinical evaluation, listening carefully to the patient's symptoms.
What are they looking for specifically?
There's a set of key features. That strong urge to move the legs, usually with those odd sensations. The symptoms starting or getting worse when resting or inactive.
Like sitting or lying down.
Exactly. Then being worse in the evening or at night.
Right, the nighttime pattern.
And finally, getting at least some relief, even if it's just temporary, from movement like walking or stretching.
So if someone ticks all those boxes,
then RLS becomes a very likely diagnosis, though the doctor will also rule out other things that could mimic it.
Makes sense. Okay, the crucial question for anyone listening who's dealing with this, can it be cured? Or if not, what helps?
Yeah, that's the key, isn't it? Currently, the information indicates there isn't a cure for RLS.
Ooh.
Okay. It's often a chronic long-term thing. For some people, symptoms might be mild and only pop up now and then. For others, it's a daily struggle.
But there are treatments to manage it.
Absolutely. While we can't cure it yet, there are definitely ways to manage the symptoms and hopefully improve quality of life.
That's good to hear. The sources mentioned different approaches, non-drug options first.
Yes. For milder cases, simple lifestyle changes can make a difference. Good sleep hygiene is fundamental.
Like a regular bedtime, cool, dark room, avoiding screens.
Exactly. Cutting back on caffeine and alcohol, especially later in the day. Regular exercise during the day often helps too.
What about things you can do when the symptoms actually hit?
The sources mention things like leg massages, maybe using a vibration device. Also, applying cold packs or taking a warm bath temperature seems to help some people.
Interesting that both hot and cold can work. I remember one account mentioned cold showers being helpful.
It can be quite individual, finding what works for you. Trial and error sometimes.
Okay, but what if those things aren't enough? What about medications?
If symptoms are more severe or frequent, then medication might be needed. First step for secondary RLS is treating the underlying cause, of course.
Like the iron supplements if someone's deficient?
Precisely. Boosting iron levels, sometimes even with IV iron, can often resolve both the anemia and the RLS.
And for primary RLS, or when treating the cause isn't enough?
The mainstays have often been dopamine agonists. These are drugs that basically boost or mimic dopamine's effects in the brain.
Do they work well?
They can be quite effective, yeah. Reducing the urge to move, helping with sleep. But there's a catch.
Oh.
Long-term use can sometimes lead to problems, like the symptoms actually getting worse over time or spreading or starting earlier in the day. It's called augmentation.
That sounds counterproductive.
It can be. Or sometimes people get a rebound effect if they stop the medication. So they need careful monitoring by a doctor.
Are there other medication options then if dopamine agonists cause issues?
Yes. The sources mention certain anticonvulsant medications. Drugs like gabapentin and acarbol are sometimes used as an alternative, especially for moderate to severe symptoms.
Okay, so there are options, which is positive. But what about the long-term outlook overall? You mentioned it can worsen.
Unfortunately, yes. The information suggests that for a fair number of people, the symptoms do tend to become more severe over the years.
Growing from moderate to severe.
Right. And that can really take a toll on sleep, leading to that chronic daytime fatigue, impacting work, social life, just overall quality of life.
It really highlights the challenge for people living with it long term.
It absolutely does.
Yeah.
And this really brings us back to a critical point from the sources.
Which is?
The need for more research. While we have ways to manage symptoms, we still don't fully understand all the underlying causes and risk factors.
Especially for primary RLS.
Exactly. We need that deeper understanding to develop treatments that are not just effective, but also safer for long-term use and hopefully more targeted.
So future research is really key.
It's crucial. It holds the promise of really improving the outlook for people affected by this condition. It makes you think, doesn't it? Something seemingly simple like feeling restless can mask such a complex neurological issue.
Yeah, it definitely underscores why we need to keep digging into these things scientifically.